Good morning, everyone. It's a great pleasure to join you today on what is the second Australian Sickle Cell Scientific Conference in Sydney. I'm very pleased to be able to join you online in what is shaping up to be a very important conference, which includes a large number of advocates and stakeholders in the area of sickle cell advocacy, from policymakers to health professionals to private sector representatives, academics, research institutions, NGOs, donors, developmental partners, community groups, patient groups, youth groups, and of course people living with sickle cell disease and other interested individuals. This is a wide range of stakeholders which attest to the importance of the work that has been conducted so far in the sickle cell advocacy, and I want to especially thank ASCA, because it was some years ago when I was approached by Agnes Nasafa to be the patron of sickle cell disease advocacy. I remember well launching the group at the Royal Children's Hospital, and I'm very, very proud that we have come. I can say that we have come a very long way since those early beginnings of this very important advocacy group. Obviously, raising awareness about sickle cell in the community and awareness raising for policymakers and also the medical profession has been critical in the work that is being done. Raising awareness leads to a need, identifying needs for further research, medical research in particular, for how we can best address preventative measures and then possibly measures for treatment of people with sickle cell, and also hopefully into the future a cure for sickle cell disease. But at this stage it is absolutely critical. The awareness levels have been raised immensely, not only in Australia but also globally. Agnes has done an amazing job networking globally with others and joining others in this global advocacy, because that's what this has now become. From my perspective as a Member of Parliament, there were a couple of aims and objectives that I have sought to assist with. One has been and continues to be the recognition of World Sickle Cell Day, which is on 19th of June, the recognition of that in the Australian Parliament, and that is something that we will continue to pursue until we are able to get to a stage where we do make June 19th the day when Parliament recognises here in Australia World Sickle Cell Day. The other very important part of our advocacy over the years has been to work towards the full inclusion of sickle cell disease in newborn blood spot screening, and to put that on the NBS program, and with a funding and implementation in states and territories across Australia, so that all Australians, wherever they may be, will have access to this blood spot screening. I'm proud to say that our government, and Albanese Labor government, will deliver on this commitment, and we will work towards making Australia's newborn screening program world class. Australia has had the good fortune to lead the way in lots of scientific and medical research, so we're all very proud that our aim is to be world class in this newborn screening program. We know how important the newborn screening program is. It enables families to identify the possibility of sickle cell disease in babies, and I know from the stories and the testaments that I've heard over the years from families just how difficult it is for them when they know that their children are not well and tend to not be well for many years until finally they are diagnosed, how difficult those pre-diagnosis years are for the family and for the people involved. So a lot of work needs to be done still, but all I can say is that the advocacy for sickle cell disease in Australia and globally is in very good hands, in very competent hands, and Australian Sickle Cell Advocacy leads that fight and for raising awareness. It leads the fight for ensuring that government and policymakers are aware of the need to invest in research, and it certainly, in doing so, provides our very large community here in Australia and internationally who have family with sickle cell disease. It provides for them opportunities to live with the condition and to improve the quality of lives of people with sickle cell disease. So I congratulate you all on and wish you all the very best on what I believe will be a very successful conference, but it will also be a conference that will bring to the fore for discussion more important research, and it will inform government and it will inform community. And to that end, I'm absolutely looking forward to the conference's resolutions and what is learned from it. Thank you.